Good afternoon, everybody in the Surrey School District. We are live with our Surrey Schools Mental Health and Wellness 40. My name is Daniel Toh. I'm a district principal in the Surrey School District. And today, as my co-host, Coralee Curby could not make it, but I do have Renee Gregerson, who is from our priority practices. And she's here. She's a helping teacher in our school district for physical health, wellness, and sexual health. Am I right? Right?
That's
Right. And I'll let her introduce herself. But we also today are very glad to have the UBC Pharmacy Pediatrics Club to present about smoking cessation and vaping. I'll let them all introduce themselves. And we also have our guest from Fraser Health here as well to do part of the presentation and to comment on smoking and vaping today. You know, it's a really appropriate topic. We see smoking and vaping as continued issues in our schools at secondary, but also sometimes at elementary as well. So it's something that that is an issue throughout our district. So if you're watching now or you're choosing to watch this later, hopefully you find staff and as students and as families, this presentation is helpful to you. But this presentation, I want to turn it over to the UBC Club in a moment. But first, maybe everyone should introduce themselves. And Ruth, I promise I'll get the district logo off your face again once we do the presentation. I know it's sitting there, but let's start with Renee. Please introduce yourself, and then we'll just go in our Brady Bunch squares of introduction.
Thanks, Daniel. My name is Renee Gregerson. I'm the physical and health education helping teacher for the Surrey School District. So focusing on K-12, physical literacy and health, which includes mental as well as sexual health. And also I've been a faculty in the education program at UBC as well. So I'm really happy to be here. Thank you.
Awesome. Ruth? Oh, you're muted right now, Ruth.
My name is Ruth Hellard-Brown. I'm with Fraser Health, the Population and Public Health Wellness Program. I am the project leader for legal substances.
Excellent. Gwyneth?
Yes, and I'm also with Fraser Health. I work on Ruth's team in legal substances in the South region. So Surrey is part of my stomping grounds. Supported Surrey School District with the finalization of the vaping report. So have some familiarity with that if there are questions there.
Awesome. Braden?
Hi, everyone. My name is Braden. I just finished my first year in the PharmD program at UBC, and I'm the Junior Outreach Coordinator for the UBC Pharmacy Pediatrics Club.
Excellent. And Kruti?
Hi, everyone. My name is Kruti Shukla. I just finished my second year of the PharmD program at UBC, and I'm the Senior Outreach Coordinator from the UBC Pharmacy Pediatrics Club.
Awesome. And last but not least, John.
John Shasky from UBC. I'm a clinical instructor at UBC, look after first, second, third, and graduated pharmacist. And I've got an interest in working with health and addiction and have been doing it for a few years through Vancouver General Hospital, right through to long-term care and in the community as well.
Awesome.
Glad to be here. Thank you.
Awesome. Thank you. So I'm just going to now turn the presentation over to Braden and Kruti and just take it away. And if you want to pause for questions, you feel free to do that. But right now, the presentation is yours. Go for it.
Thank you, Dr. Toh. So we're just going to get started. Like we said, my name is Kruti. I'm joined by my colleague, Braden, and we're part of the UBC Pharmacy Pediatrics Club. And today we will be presenting to you on the topic of smoking cessation. So before we get started, let's just briefly go over why is smoking so appealing. I have listed 3 reasons, but there's definitely way many reasons as to why individuals choose to smoke. So one of the ones is, it provides a short-lived high state. So individuals, if individuals are feeling like stressed or they're anxious, that all those like chemicals and all of those substances that are actually present within the smoke or the vape actually provides a sense of euphoria, which Braden will kind of briefly go over some of the, what happens on the brain level. So we understand why, we experience that high state and that euphoria, and that kind of helps like individuals cool down. So that may be one of the reasons why individuals choose to smoke. Number 2, it's, potentially gives one the edgy look. So, they feel that, we're doing something cool. We're part of this club. We're part of this hood. And it kind of gives them that sense of familiarity. And that brings on to the third point, familiarity. So if their friends or family also smoke, then they feel that, okay, if we also smoke, we'll be part of something big. So there's the whole social aspect of it as well, so that they feel included, they feel that they're part of something big as well. And like I mentioned, there's also other reasons as well.
And so now onto some statistics. So first you'll see that total smokers in Canada, there's about 4.16 million as of 2020. And so when we consider that Canada has about 38 million people in the country, roughly 1 in 10 smokers are Canadian. It's the other way around. 1 in 10 Canadians are smokers. Next, you'll see that between ages 12 to 17, there's about 43,000 smokers as of 2020. Between ages 18 to 34, there's about 1.2, 1.3. And then next, you'll see that there are 69 carcinogens in tobacco smoke. So carcinogens, in case you don't know, are substances that cause cancer. And we'll get into that a little bit later. And then finally, you'll see that people who smoke 25 cigarettes a day have 3 times more of a risk of heart attack or stroke compared to non-smokers.
So I'll briefly touch upon the different smoking products that are available. So these are your traditional smoking products. That's your standard cigarette, there's a little cigar, there is the different kinds of cigarillos, and lastly, the big, standard cigars that we see in movies. The important thing to note about these ones is that they're primarily consisting of tobacco. So tobacco is actually one of those substances that causes, diseases such as different types of cancers, especially like lung cancers, several respiratory diseases, and also, heart conditions. And also, like one of the primary one is COPD, which is also chronic obstructive pulmonary disease. And if those of you who don't know what it is just imagine like not being able to breathe, like going a flight of stairs and just being completely out of breath. Individuals who have that condition, that's how they're constantly feeling. They're constantly out of breath, have difficulty, like breathing and just performing their daily activities without having that feeling of constantly running out of breath.
So now let's get into some short-term effects of smoking. So on the next slide here, we have a handful. Let's go through them one by one. First is the obvious one. You'll have bad breath, which is not fun for yourself because you can taste it, and not fun for others around you because they're going to smell it and they're just simply not going to want to talk to you. And it's just not going to be great for anybody involved. The next one is that you'll have fatigue and decreased energy, which can affect your day-to-day activities from, wanting to wake up and getting out of bed to wanting to go to school or wanting to go to work. You're going to have an overall decrease of energy and lethargy, which is going to be difficult for you to just go throughout the day. That gets into the shortness of breath as well. And you're going to have experienced shortness of breath, which makes it harder for, going on walks or running or doing any sort of activity because of the impact that smoking has on your lungs. You're also going to be coughing a lot. And then you'll have a reduction in taste and smell too, which is not great if you want to, smell flowers or smell good food or even taste food. But beyond that too, we won't be able to smell dangerous smells. So for example, if there's a fire nearby, you might not be able to smell it, and it's going to be harder for you to, get out of harm's way and get yourself into safety. And now let's get into the contents of a cigarette. So like I was explaining earlier, there are 69 different carcinogens in tobacco smoke, but they have what's called the top 6 toxins. So benzene is a group 1 carcinogen, and like I was saying earlier, a carcinogen is a substance that can cause cancer. The next one is nicotine. Nicotine causes addiction, and I'll explain that a little bit later in the presentation. The next one is carbon monoxide. So carbon monoxide reduces the ability of red blood cells to deliver oxygen to your tissues, which can cause a variety of health issues. The next one is formaldehyde. So formaldehyde causes irritation and breathing problems. And then there's hydrogen cyanide. So hydrogen cyanide is considered the most toxic chemical. It causes nausea, vomiting, weakness, as well as skin and eye irritation. And then there's tar. So tar is like a black sticky residue, and it contains a lot of carcinogenic compounds. And on the next slide here, like you see, this is how tar looks. So it comes in a variety of different forms and viscosity, and that's getting inhaled when you smoke a cigarette, which is, as you can see, really, really gross. And so on the next slide here, essentially what we're showing is that smoking can cause a variety of different chronic diseases and cancers, and essentially it can damage every part of your body. So for example, with heart disease, smokers experience short-term stiffness of their arterial walls. And what this is going to do is it's going to increase the risk of plaque rupture. And research has shown that nearly half of the deaths from coronary heart disease aged 45 and under were due to smoking. Now, with bladder cancer, 25% of those diagnosed with bladder cancer are expected to die within 5 years. And with lung cancer, smokers are 25 times more likely to die from lung cancer compared to those who don't smoke. And now, only 16% of people diagnosed with lung cancer are expected to survive 5 years after their diagnosis. Research has also shown that nearly 80% of lung cancer deaths were due to smoking. And now, with oral cancer, your risk of oral cancer is 5 to 10 times higher in smokers compared to non-smokers. And 37% of those diagnosed with oral cancer are expected to die within 5 years. So while it's a slide that was talking about a lot of death and harm, essentially what we want to get at here is that your body's going to get affected, and a lot of conditions can be caused. And like you see on the slide here with this graph, your whole body's affected. And now let's get into nicotine. So nicotine is highly addictive, similar to heroin and cocaine. So physiologically, what happens is it interacts with the nicotinic acetylcholine receptors. And what that's going to do is it's going to stimulate dopaminergic transmission. So it's going to stimulate the release of dopamine. What's going to happen is with chronic nicotine stimulation, so the more nicotine you receive, it's going to start affecting the GABAergic neurons. And that's going to cause the GABAergic neurons to be desensitized. And then what that does is it's going to lose the ability to inhibit dopamine and regulate our moods. So essentially what happens is the more nicotine you have in your body, the more that goes to those receptors, the more it's going to affect the inhibition and release of dopamine. So that's kind of how addictions are caused. The more nicotine that's there, the more it's going to want so that dopamine can be released. And then your dopamine levels are all out of whack. So like I said on the slide here, some immediate effects include irritation and burning sensation, increased salivation, vomiting, and diarrhea. It's highly addictive. In terms of metabolism, it can lead to weight loss. And essentially, it negatively affects all systems of your body, like specifically circulatory system, respiratory system, renal, reproductive systems, and it can impact brain development as well.
Can I ask a question as you're going through these things? So I heard John in our pre-discussion, John actually had said, mentioned something that I remember studying when I used to teach social studies, is that in certain countries, they used to give out 2 cigarettes a person, and because nicotine was so highly addictive. And I know you also mentioned that, there was a coolness factor, an edge factor to smoking, and I'm sure you'll get into the vaping a little bit later. But I just want to pause briefly, and Renee and the Fraser Health folks, I'm sure we don't have to pass out cigarettes and things. The tobacco companies are obviously not doing that. But why are kids, do you think, are starting, even now, with all that we know, all this great information, and again, the presentations are going to continue. But why do you think kids start now, even with all of this great information? You can die from this. Maybe you start with Renee, and then Gwyneth, Ruth.
Daniel, in my understanding and my experience as an educator for the past 15 years, you can tell a young person that you're going to get wrinkles or bad breath or whatever, but I find with being a youth and trying to figure out who you are, it's about a connection and it's about wanting to belong. And so when I see those students who are in the smoke pit area or vaping together, you feel a part of something. And you're not really a part of it unless you're doing what the group is doing, right? And so for me, it's a way for students to connect with each other. And that's why I'm always looking for other ways that we can open up opportunities for our students in Surrey, ways to connect in a healthier way. But that's my understanding.
Mm-hmm. Yeah, I'll just chime in. It's also that physiological response, right? Because even on the very first puff, there's that kind of magic high feeling, and that is the very, very nature of nicotine addiction.
Absolutely. Professor, anything to add, John?
Yeah, that's really good conversation that we've got here. And you have to remember, if anybody goes back, there was the movie a few years ago, The Three Stooges. They were from way, way back. In 1941, there's an episode where Curly gets squirted in the face with one of those water pipes. And he says, I'm just going to go back to my cancer stick. So knowledge has been out there for a long, long time. But it is about the the wanting to belong and everything. And when I was playing hockey, I remember, in fact, one of everybody's idols who just passed away just recently was a heavy smoker who died of lung cancer.
That's right, yeah.
Guy Lafleur just passed away, and our coaches in those days would single those guys out that were smokers and really ride them hard so they felt what cigarettes actually did to them. And it was hats off to those guys. That was in the 70s and the 80s. So the knowledge has been out there, but I really like to hear that there are other things that we can do to be part of the group. And this is what I'd like to see more of.
Okay. And before Braden and Kruti continue, Gwyneth, any final words to add to this part of the discussion?
I would agree with everything that's said. And I think it's interesting that movies got brought up, because there was a time when Hollywood was really on board with tobacco control and really worked to not show tobacco in movies. And tobacco product placement in movies has been increasing dramatically over the last number of years.
I didn't realize that. Increasing.
Watch a movie and you can, like The Hobbit, they've got pipes everywhere, right?
Yeah.
Like there's a lot of tobacco placement happening in movies now.
Yeah, okay. Well, thank you so much, Braden and Kruti. Sorry, this is what happens when you're on the Surrey School District version of The View. I just start randomly asking questions. But let's turn it back over to you folks for a little bit.
Awesome. Yeah, no problem. It was a great discussion. And so on the next slide here, essentially, it goes into how does nicotine work in your body. So I'll go through that one by one with everyone. So first, when you smoke a cigarette, nicotine gets absorbed through the mucosal lining of your nose and your mouth. And so when you inhale, nicotine passes through the lung membranes and then into your bloodstream. So after it reaches the bloodstream, nicotine gets to your heart, but then gets transferred to your arteries and then up into your brain. Once it reaches the brain, it stimulates the release of adrenaline and dopamine. It was like I was explaining on the last slide. It reaches those receptors, and then when there's more nicotine there, it gets inhibited, and then your dopamine release gets all out of whack. And that's how addictions come to be. So like I was saying, dopamine is a neurotransmitter. It allows us to feel pleasure, feel euphoria. There are certain activities that can elicit dopamine. So for example, eating food that you really enjoy, playing games, winning, as well as smoking cigarettes. So this feeling of wanting pleasure is how addiction to cigarettes come to be, because when dopamine gets released, that feeling of pleasure is what you feel. So like we were saying, when we were talking just a few minutes ago, the more nicotine you consume, the more it's going to get inhibited. Then you want more of that nicotine because you're going to have that feeling of pleasure elicited in your body. Now, on the next slide here, let's get into regular smokers versus social smokers, because, maybe only smoking a little bit or just socially, could that be better for your body? Could it be better and healthier than regularly smoking all the time? Well, there's a study here that looked into regular smokers who smoked all the time, social smokers who only smoked occasionally in social gatherings, and then non-smokers. And they looked at the risk of cardiovascular disease. So there are three groups there. There were current regular smokers, social smokers, and non-smokers. So what they found was that with social smokers, there's significantly higher risk of high blood pressure and elevated cholesterol compared to non-smokers. But what's really interesting here is they found that with social smokers, there was no significant difference in risk between regular smokers and social smokers when it came to cardiovascular disease. So the big takeaway here is that regardless if you smoke occasionally or all the time, your risk of cardiovascular disease is the same.
Wow. Huh.
And so now on to
no, I didn't know that.
I know, right? It's really just mind-blowing. So on the next slide here, what are some benefits of quitting smoking? So short term, within 20 minutes, your blood pressure returns to similar levels before your last cigarette. And then after a few days, the carbon monoxide levels in your blood return back to normal. Some other added effects include just simply saving money from buying tobacco products. Food is going to start tasting better for you. Your sense of smell is going to get back to normal. And overall, you're going to smell better. And then some long-term effects. Within 1 to 2 years after quitting smoking, your risk of heart attack drops dramatically. And then within 10 to 15 years after quitting smoking, your risk of coronary heart disease is similar to that of a non-smoker, and your risk of cancer decreases. So one thing about that stat is that it takes 10 to 15 years after quitting smoking, to get back to levels of a non-smoker, which is quite a long time, but it just shows the impact that smoking can have on your body. And then some other added effects, simply physical activities become easier on your lungs. You have an increase in overall energy, And of course, less financial burden, which we really want to emphasize here, because the cost for 10 cigarettes a day is roughly $6, $5.75. So yearly, that's over $2,100. So if you don't buy tobacco products, you're going to save that much money, and you can buy 360 Frappuccinos if you really wanted, Grande Frappuccinos from Starbucks. So instead of smoking 10 cigarettes a day, you could get a Grande Frappuccino from Starbucks almost every day of the year. And then
That's
same
awesome.
thing with nicotine replacement therapy. It's a little bit cheaper, so you save about $1,500 a year. Nonetheless, that is savings that you can spend on anything you want, like taking a trip overseas, going to watch a Canucks game, anything. You save so much money from it. And I can't emphasize enough. We can't emphasize that enough. Not only is quitting smoking so good for your mental health, physical health, every health aspect of your body, but also financially, you're saving so much money from it too.
So thank you, Raiden, for that. So we went over the benefits of smoking. Now we're going to go over some of the techniques that, individuals can try to quit smoking. So here we have a few. So first and foremost, set a quit date, whether be it in a week from now, 2 weeks from now, a month from now, or 6 months from now. Set that date and then, mark it and make sure that, you follow through with it. After you have done that, that's the biggest step. And then after that, you can move on and, do step two, which is talk to your family and friends about quitting. Get them involved, like having that encouragement and that support from family and friends is crucial to like your success in this quitting journey, because quitting smoking is not easy, and all the factors that Braden mentioned about having those effects on addiction and just dependence makes it so much more difficult. But if you have that social support, it makes it easier for you for that journey, for you to go on that journey. Number three is to avoid social environments where you are more likely to smoke. So, if you are hanging out with friends at a particular spot, where you usually smoke, if you go there, just out of natural instinct, you would want to smoke. And so I know it is difficult, but in at least in the first few, I would say like 2 to 3 weeks, it's best to avoid those areas and those environments. And if individuals feel that their social company is actually going to those social environments, maybe they can speak to a counselor or speak to someone they trust, and then they can help them avoid those social environments as well. And number four is to reward yourself. Like we talked about how quitting is not easy. It's a difficult journey. But we also learned about how, the dopamine that nicotine stimulates, plays a role in the reward pathway. So if you reduce that nicotine consumption, you're going to feel that you're missing out on something. So, let's say if you don't smoke for like, 2 days in a row, or like you like quit or have the number of cigarettes you smoke, reward yourself because you're doing something amazing. And if you keep on rewarding yourself, like, buying something for yourself, or going to a concert, things are opening up, or attending a game, or with all that money that Braden just mentioned that you're going to save, you can definitely go on a nice trip with your friends. Like if you reward yourself that way, it will make this journey so much more easier for you. And number five is to keep yourself busy. Take up a new hobby. Try something different. Like I don't know, maybe like play some games, or like take up art, whatever interests you. Traveling, like I mentioned, those are the things you can do to keep yourself busy and distract yourself. And a lot of things that individuals do, have a difficult time with is cravings. Like when they're in some stressful situations, and they just have this urge that like maybe just smoking one cigarette will like help me like ease all the senses and everything. So this is actually written on the Quit Now resource, which is like quite helpful. So these are the 4 Ds for cravings. So that is to delay. So delay as much as you can on how much on when you're going to like take the next cigarette. Distract yourself. Like I know, like when I'm studying and I get super tired and I'm like, okay, I just want to nap, like I don't want to study anymore, I distract myself. I'm a big time BTS fan, so I just watch one of their music videos and I get all energized and pumped, and I'm like, okay, I'm ready to study again. Like distract yourself. And drinking water, like we all know, like everyone says, water is beneficial, good for you, and it also helps you reduce your cravings as well. And and deep breathing. Like deep breathing, not only will it calm you down, but it will also help with the cravings that you're experiencing. And so these are the things that I mentioned. These are also what we call the non-pharmacological, measures for you to quit smoking. So it's like it doesn't require you to take any kind of medication or anything. But if you feel the need that, maybe I do want to take something, I do want to try some medication or any kind of options that are available for me to help in the smoking cessation, journey or the quitting journey, you can speak with, your healthcare professionals like doctors, nurses, and pharmacists, and they can talk to you about the smoking cessation program. So quitnow.ca is like, a very, very beneficial resource that you can go to find more information regarding all these products and things that are available out there. And there's also smoking cessation clinics that you can talk to where you can speak with your doctor, and then they will find the most suitable and most appropriate medication regimen for yourself.
Okay. Well, speaking of the health professionals, and we have a couple on here, which one of these, in your opinion, Gwyneth and Ruth, do you think that work for, like, do they work sort of in concert with each other, or are they just individual, like whatever works best for you? How do like, if I was watching this, I'd be like, okay, which one of these will work for me? I smoke every day, right? Ruth, Gwyneth, what do you think?
So your best chances of quitting smoking is if you combine counseling with pharmacotherapy. So ideally you would hook up with Quit Now, because they will connect you with the counseling side of things. And if you go to any pharmacy, you can ask for a one-time supply. It's a course. I forget now if it's 6 weeks or 10 weeks or however long the course is, on nicotine replacement therapy.
Okay.
And your pharmacist will provide that for free.
Okay, awesome. Ruth, anything to add from a health perspective?
Yeah, no, just agree 100%. It's doing the both together, and it is indeed 12 weeks that you can get a free NRT. And I think that Curti is going to cover this in the coming slides, but NRT is by label only for those over 18 years old. So the pharmacist has to be aware of that, speaking to anyone younger than 18. We generally advise in our materials advise physician consult for NRT for youth.
Okay, well, and please know I do appreciate these answers, because just for those who are watching either now live or after, I've not prepped anybody with any questions. So these are just like, I'm just asking them. But Renee, I've taught school. I think I taught school with you, right? Like, does this work for kids? Like is a 14-year-old going to say, I'm going to set a quit date. I'm going to talk to my friends and family. I'm going to delay, distract. Like, I don't see kids doing it. Like how do you, when teachers are asking you, like, how do I convey this to kids, right?
I think for me, I would, in my approach as an educator, I would have the students really look at the why. So why are you choosing to smoke? So what is it, right? Is it that I get really anxious and, like was mentioned, I have a puff or two and I calm down, I feel a bit better. So it's sort of like a coping thing for me. Is it, again, like I said before, a way to connect with my friends, or just something to do because I'm bored? So I'd really dive into that with my students on why are you choosing to do this behavior? And then if they do want to quit, really getting them to understand their reason why they want to quit, because that will be that common thread that kind of they can lean on as they go through this process. And I would highly encourage them to connect with other, people their age that have gone through the same challenges, and they can empathize and kind of, you can talk over your, and discuss, like, I'm really struggling here. What did you do? Right. It always helps me if someone I know has gone through a similar experience, and you can just sort of, kind of lean on them and have that support there. So.
And John, I have a clinical question for you, as I would for the person in charge of all of this. I know that when you talk about cigarettes, people say, okay, yeah, I know that's bad for me, the cancer stick. But I don't think people think the same of pipes, cigars. In fact, there are whole cigar clubs. I just watched, this is like, for those of you watching, if you don't like Star Trek, I'm sorry, but I just watched Star Trek Picard, the second season. And one of the main characters ends up, like, I guess, like celebrating his success by putting a cigar in his mouth. And I was like, yeah, this is awesome, right? And we don't see cigars as the same. Like, how do we or as you as a clinical instructor, or as a person who teaches people about these things, show them that this is actually all the same. They're not different. There's not one that's better than the other, you know.
That's right. In fact, at one point, I think they used to say pipe was a little bit better than a cigar, which was a little bit better than a cigarette, but it's all bad for you. And it's just a matter of degrees. I mean, you know, it doesn't make any difference. And I really like what Renee was saying, actually, is that I say it's all bad, no matter what. And I try to find out why, which is excellent. And by finding out why, try to individualize the journey for the person. So it's not one way fits all. It can be a whole hodgepodge of different things. And what's really important is to get into that why, and then what do you think will help you in your situation? And then help that person, give them support in whatever they need.
Awesome. Well, Braden, Curdy, back to you.
Yeah, so we just briefly touched up on the smoking cessation program. So like Ruth mentioned, you know, it's something that we as pharmacists working in community pharmacies actively talk with our patients about. So what it is that it's a program that's offered to eligible British Columbians, and it's where the government fully covers, you know, 3 consecutive months worth of NRT. So that's nicotine replacement therapy, and that includes patches, gum, and lozenges. And so you can speak to a pharmacist to discuss the benefits of the NRT. But like Ruth mentioned, you know, if you're under the age of 18, it is best that you speak with a physician to see if it's the most appropriate, as they will determine, you know, like other factors such as like, you know, your age, your weight, other like conditions that you may have. So they will take a look at the whole holistic picture, and then they'll see if this is the most appropriate treatment for you. And, you know, like if you are interested in this, you know, if you're over the age of 18 and are interested in this, you know, like nicotine replacement therapy, again, like the first 3 months are covered. So that's completely free. And afterwards, we did go over like, you know, the cost, and it still costs like, you know, $500 to $600 less than actually smoking continuously, or at least having 10 cigarettes per day. So you'll be saving money that way. And, you know, pharmacists will go over like, you know, how many cigarettes you smoke, and then based on that they will give you like, you know, which particular product is the most correct one for you. And yeah, so now I'm going to briefly touch up on the topics of e-cigarettes and vaping. So, you know, so these are newer on the scene, and as we discussed previously, you know, these are on the rise. Like, you know, young adults are continuing to use these more and more as time goes by. And as you can see, they come in so many different, like, you know, shapes and sizes and forms, and there's just so much variation out there. And like, as you can see, like, just these are just some of the advertisements I found. You know, they're like advertised as being like portable, you know, easy to use, and like a safer alternative in some sense to tobacco smoking, which are like the traditional products. So that's how they're like, you know, advertised. And one thing to note is that e-cigarettes, they contain other chemicals, but many of them are primarily made of nicotine. And as we discussed, nicotine is, you know, that one substance that is just, you know, it stimulates all these like, you know, hormones and like neurotransmitters within your brain, and, you know, makes everything's messy. So that's why e-cigarettes, even though they're advertised as a safer alternative, are actually not true. And we'll go into that later on. So before we go into, you know, other aspects, let's take a look at, you know, the different kinds of e-cigarettes that are available. So, you know, all these like images that I showed previously, they can be divided into 2 different types. So there's the closed systems and the open systems. So the closed system e-cigarettes, you know, they're sold out by the tobacco companies, and these contain like a mouthpiece and a cartridge and a battery and the power indicator. So the important thing about these ones is that these are not reusable. So once like the cartridge is empty, it's just use and throw. And your these tobacco companies who manufacture these, you know, closed system e-cigarettes actually send out a monograph. So individuals who are inhaling these products actually know how much of each of these chemicals and substances are actually present. And, you know, as we talked previously, all of those substances that Braden mentioned, they are still, many of them are still present within these e-cigarettes. And so having that information, individuals actually know that, okay, I'm inhaling this, I'm choosing to inhale this, but I know that it contains this percentage of nicotine, this percent of like some flavoring agent or like glycol and other sorts of toxins. Whereas for open system, these ones are quite different because these are refillable and they're reusable. And this is where it's, I would say, more dangerous because with these systems, individuals can actually pick and choose the flavors or the solvents, or even the they can even set the temperatures for some of these devices on how, how much they want to smoke or like what it is that they want to smoke. So there's just so much variation. And like, and with these in particular, like the e-liquids that are sold separately, many of them are not government regulated and they're outsourced illegally. And so that is quite scary because even though like with these closed systems and with like traditional smoking products, we know the contents, we don't really know the contents. So it could be way more harmful than what we already know about these, e-liquids and the contents that are present within them. And so that's why these open system e-cigarettes are much more scary because we don't really know what's in there and we don't really know what it is that we're inhaling. So that's what's scary about them. And that brings the next point. So EValley, so that's the e-cigarette or vaping use associated lung injury. So this is specifically linked to vaping and e-cigarettes use. So what it is that there's different symptoms that individuals can experience if they have been diagnosed with this particular condition. So the standard ones are your respiratory ones. So that's your cough, shortness of breath, and chest pain. So individuals will constantly feel that, stomach-related issues such as nausea, vomiting, and diarrhea. And then some may also experience fevers and chills. So what causes this EValley? So it's the vitamin E acetate, THC, which is found in cannabis, and other components that are present within these e-liquids. So many of these chemicals that are found within e-cigarettes and e-liquids are actually what's causing this specific condition. And as of August 14th, 2020, so far there have been 20 cases that have been reported, but this trend will continue to go up as we have discussed, the number of individuals choosing to vape is also increasing. And the scary thing about this is that because this is just like this condition is still being studied, we don't really know what its downstream effects will be. We don't know how dangerous it will be, in 10 years from now, because research has still needs to be done. And so that's pretty scary.
Now, before I ask the Fraser, I'll just interrupt a bit. Renee, you and I are both parents, and I'm sure some of you others are parents as well. Why? I can't figure out for the life of me. Like, I wouldn't buy this for my kid, but more like every single time we take a vape, almost every time, 90% of the time, we take a vape away from a kid in school. It's like, oh, my mom bought that for me. My dad bought that for me. Someone bought, like my older brother. Like it's all like I wouldn't ever hear that when kids were smoking. Like my parents bought me smokes, or like, maybe I took my dad's smokes, but not they went out to a store and bought it. Like some kids are getting this as gifts. Like, what makes parents think that this is okay? I'm going to ask the Fraser Health folks a similar question right after, but what do you think?
Well, I think that, we are starting to understand a lot more about what vaping does to our body and the chemicals and how it's affecting us. But I think, with older generations, we have had years of understanding the real effects of regular cigarettes, right? And how that is, we've seen people and the deaths and, all that kind of stuff, right? So I think it almost, in some way, it feels like it's sort of a safer option or a better option than cigarette smoking. And like I said, then, the students don't feel like, or they don't go back to class, they're not reeking of cigarette smoke. So maybe the parents or guardians feel that that's a better option.
Yeah, and to the health folks, this did, when I have done presentations with some of your colleagues before, and it did start out like e-cigarettes back in the day started out as a smoking cessation. It was to help. And now it's become a fad. Like I don't know how many cars I've driven by where there's like puffs of smoke coming up and it's not the exhaust, it's coming out of the windows, right? What has shifted in health that this has now stopped being a help to stop smoking and become the replacements for smoking, in your opinion?
Well, I would question whether e-cigarettes were ever designed as smoking cessation. They've certainly been used as a harm reduction mechanism. There is certainly some literature that indicates that e-cigarettes are less harmful than traditional cigarettes, though certainly not harmless. But as a harm reduction opportunity is different than a cessation opportunity. And when we talk about harm reduction opportunities, we're talking for adult smokers who are smoking quite heavily, and have tried other forms of tobacco cessation. So we have NRT, nicotine replacement therapy inhalers. So we have approved and regulated cessation NRT. So that the e-cigarettes for cessation is not an argument that I think holds much weight.
Excellent. Ruth, and then I have one more question for John that's similar. Oh, you're not unmuted yet, I don't think.
Bad habit. Just circling back to Renee's comment and parents buying vapes for their kids. I think that the myth of vapor being harmless does perpetuate itself, and I think there's still a lot of belief around that for both parents and students. So why not buy the vape? It's not going to hurt them.
Yeah.
Makes them cool. Yeah.
Yeah. John, any further comment on that from a clinical perspective and research perspective?
Yeah, I think Ruth has nailed it. That they don't know, so they think they're doing the right thing. I'm sure they don't want to harm anybody, even though they are. So, but not too much research on that. And don't forget, I think that what happens in Great Britain, although is very useful, we are a different culture here than there, or even in Alberta versus Ontario. So it's hard to say why that's happening in British Columbia.
Thank you so much. And Braden Kruthi, take us home. I think thank you for just being patient as I interrupt with multiple questions, but I do know we have a lot of expertise here. I like to get the discussion going as well. So please take us home with your presentation. It's awesome, by the way. Thank you.
No, for sure. Yeah, so now we're just going to debunk some of these myths surrounding e-cigarettes and vaping. So, these are like the ones that we will touch upon today. So e-cigarettes are harmless and can be used as a form of smoking cessation. So we just talked about this, that is not true. There's actually no study that actually supports that they can be used as a form of smoking cessation. And as like Gwyneth mentioned, yes, they can be it is harm reduction, but like smoking cessation or they can't actually cause they can't actually be used to reduce sorry, I'm at a lot of soft words, but what I'm trying to say is you can't actually use e-cigarettes as a form of, going towards better health outcomes, because even though it doesn't contain as many, for example, toxins or carcinogens that Braden mentioned as a regular tobacco cigarette, it still contains many of the chemicals that, tobacco smoking does. But the thing is, there's just so much variation also in terms of the chemicals that are present within e-cigarettes that we can't actually be sure how damaging it is. So John and Ruth mentioned, there's still some research that needs to be done before we can say, how much it's going to harm an individual if they consume e-cigarettes. And there's, like I said, there's no studies that show that it can be used as a form of smoking cessation. So that's a myth. And the fact that, individuals think that vapor is harmless and it's just simply water vapor, that's also not true, because there's actually many toxins, and it's there's volatile organic compounds, there's heavy metals and things like that that are actually, emitted within the vapor itself. And the thing is, the flavoring agents and stuff actually cover that smell, and that's why individuals can't smell it, but it's still present. It's just being covered off by the flavors, which some of these flavors are actually more dangerous than one can imagine. And lastly, nicotine is relatively safe. You know, there are individuals who would think that nicotine is safer than tobacco, but that's not true. Like, like as we mentioned, it causes addiction, it causes dependence. And one thing to note is that our brains actually develop, they're developing until we reach that, mid 20s point in our life. And people or individuals who smoke or like consume nicotine at an earlier age actually have, you know, a decrease in the growth rate of their brain. So their brain is not developing at the normal pace that it should. And that leads to like problems such as, difficulty focusing, difficulty recalling information, and just being able to like, comprehend some of the concepts that, individuals learn, and just having a harder time to study, for example, and having reduced attention span, just to name a few. And yeah, so there was actually a guide that was just posted this February, and it's by CAMH, which provided some information on vaping cessation. So we're just going to go over some of the helpful tips that they noted. So number one is, if individuals are consuming both smoking and vaping products, then it is advised that they completely switch to vaping. Yes, we know both are harmful, but instead of using two different, like smoking and vaping like products, it's best that they switch to just vaping. And number two, try not to purchase black market e-liquids pods or devices, because we mentioned those are not government regulated and we actually don't know what's inside, and it could be way more dangerous than we predicted it to be. And number three is to avoid switching products and or vaping devices. So if you do choose to continue vaping, just continue to use the products that you are using, and not switch between them, because like I said, because of the variation, you don't really know what it is that you're inhaling. And number four, speak with a trusted healthcare professional for one-on-one counseling and on ways of quitting. And then, if you speak to them, can actually enroll you into programs, that are like peer counseling programs. So you, along with like other individuals who are also going through the same thing, you can connect over that and, like help each other out. And they can also help you establish self-management skills. So what you can do if you're having that craving, or if you just want to, like be able to like decrease the amount of time you're vaping and things like that. And so why is it important to seek help? Like, the journey to like smoking cessation or vaping cessation is not easy. Like I have seen individuals that come into pharmacies, like the pharmacy that I work at, they tell me their journey that, oh, like we tried quitting like 1 year ago, it didn't work. We tried quitting 10 years ago, it didn't work. But, like we want to learn more about that nicotine replacement therapy. Like individuals want to like, reach that like final goal of like quitting smoking, but it is difficult because of so many factors that are involved. And so if you seek help, so if you speak with your friends, if you speak with your family, if you speak with, your healthcare providers that you trust, they can not only provide you information, but they can also provide you the support that you need. Because every single individual is different. And what worked for one individual on their smoking cessation journey might not work for you. So speaking with healthcare professionals they will be able to like determine what is the most effective method or the best path for you to take, for you to go on this journey. And they're there to support you and guide you. Like, this is ultimately your journey, and you're the one who's on the wheel, and we're just there to support you. And just in terms of what pharmacists do, like we're big on medications, right? So they can provide you more information on what the current medications you're taking and how that interacts with the contents that are present within like cigarettes and vapes. So that kind of gives you like a clear idea of what it is and how it's actually impacting your body.
And so just to summarize here, first, remember that carcinogens will be present regardless of the chosen smoking device that you choose to use if you do go down this path of wanting to smoke. The next one is that nicotine is the main culprit, which causes addiction and dependence. And then regardless of the device chosen, you're still at an increased risk of developing various chronic conditions, like it shows here, cancers, heart conditions, and breathing problems. And I remember emphasizing this a lot a while back. Stop smoking, you'll save money. And then, of course, quitting smoking will improve your everyday quality of life.
Yeah, and we just want to make the statement, like as current PharmD students, like we do study about these effects of like these substances and like the medications and how that causes an impact in your body. We highly encourage you to not partake in smoking of any kind to achieve good health and to maintain a healthy lifestyle.
And now, just beyond that, too, like we understand and we respect everyone's right to make decisions of what they want to do, what they want to ingest and inhale in their bodies. But if anything, we really encourage you to take from this that we highly, highly discourage not only using any of these products, but especially products that are non-government related off the black market, whether it be black market cigarettes, black market e-cigarettes, vapor products. We highly, highly discourage the use of anything that is not government regulated, on top of just discouraging the use of any of these products in general.
Well, this is great. Thank you so much. Oh, did I take off away your slide? That's right. Okay, perfect. This is good. But I do, as I told you, 45 minutes goes by fast, and I hope even at the age of 47, my brain has not stopped growing, and that you've increased my neural pathways by the presentation you gave today. But I do want to give last word. I'm going to go in reverse order. I'm going to go with John, then the Fraser Health nurses. I'm going to end with my co-host for today, Renee. Any last words for the presentation and the encouragement to the folks, whether they're staff, students, or families watching, about vaping and smoking, etc.? John?
Right. Well, that was a great presentation, everybody. Thank you very much for including us. And the important thing is that final message: don't do it. Your health depends on it, and you'll wish you hadn't if you do. So please just don't.
Thank you, John. Gwyneth, Ruth?
Yes, thanks very much for including us. I guess I would encourage, if there are youth listening, just say no is not a message that's necessarily, going to change behavior, but maybe encourage folks, if you want to know more, or if you just want to have a conversation with a supportive adult, to really explore the reasons why you choose to vape and some of the reasons why maybe you're questioning it. So yeah, that's my final message, I guess.
Ruth?
Yeah, I guess what I would say, if you vape or smoke, most people who smoke certainly want to quit. Look for help, because that's the best success you'll have, is if you can get some support.
All right, Renee, final word to you.
I just have actually just two comments. It was interesting, that ad that was shown, and it said, "Take back your freedom." And to me, that's like an oxymoron, because I think that if you have an addiction, there's no freedom there. It kind of runs your choices and your behavior every day, right? So that was really interesting. My second comment is just, I have that education lens, and it's the idea of really working with students and youth on, discovering who you are and what really speaks to you. And I used to always ask my students, what gets you really excited? What do you love doing that you just feel so alive? And working on healthier options and opportunities with our students and our youth, and guiding them in that healthier way. So.
All right. Well, thank you so much. And thank you, UBC Pharmacy Pediatrics Club. You guys are both going to be great pharmacists. And John, thank you for guiding your students towards this presentation. And of course, Gwyneth and Ruth, our partners in Fraser Health, thank you so much for being here. Thank you so much for the time. It's 53 minutes and 7 seconds, longer than I thought, but hopefully those watching either now or later will find it a helpful presentation. I will, please don't leave. I'm going to end the broadcast, but please don't leave so I can say my final goodbye to you. But for those who are watching in the Surrey School District and beyond, thank you for taking part in our presentation today. Have a great day.